the station that's on your side. This is Channel 7 News Daybreak.
All right, welcome back, everybody. 6:23 is the time heart attacks and heart-related problems peak every year over the winter holiday season, specifically on Christmas, the day after Christmas, and New Year's Day. Days should be celebrating. Now, studies show heart attacks increase by 30% in the wintertime. Why is this? Joining us this morning to explain is Baptist Health doctor, cardiologist, Dr. Anthony Fletcher. And we've got 6 ways that the Grinch can steal your heart. Healthy holidays. Dr. Fletcher, good morning. We are going to try and avoid those this morning. Okay, let's first tell people what the 6 ways are, and then we can expound on those. So cold temperatures, overexertion, nonstop feast, alcohol, ignoring symptoms, and catching a bug. Let's start with cold temperatures. What do you mean by that?
Cold temperatures. You know, it's wintertime.
So how does that affect the heart?
Well, the heart actually has to react to those cold temperatures. Cold temperatures raise your blood pressure, and it causes the arteries to constrict. Okay. And that's the way of the body kind of conserving heat, and especially in your extremities. So the heart has to work harder to do its job. It actually can cause a spasm in the corneas itself if you have underlying problems. And so the heart itself is somewhat under duress with excessive cold and even sometimes excessive heat.
Okay, overexertion. What do you mean by that? Just running around shopping? Or?
Well, you know, holidays. You know, we do things that we don't normally do. We're shopping.
Yeah, a lot.
You know, we're also stressed because of the holidays. You know, we're putting up Christmas decorations. If it snows, we're out there shoveling. And those things are kind of more than we're used to doing. And the heart's not ready for that. You're not conditioned. And then sometimes people are dancing over the holidays. You know, just so many things. They're going nonstop, less sleep. And so that's an added stress, and that raises blood pressure, and pressure causes issues with the heart.
Holiday parties, dancing, of course.
Parties,
yes,
absolutely.
Non-stop feasts.
Oh my goodness, you know, it's the holidays. Everybody says, you know, I'm going to enjoy myself.
Since Thanksgiving.
Grandmother's favorite dish, your mother's favorite dish, your friends come and you just overindulge. You have parties to go to. And so consequently we eat more calories. The number of salt-laden issues in terms of food goes up. Cholesterol levels are high. And so all this raises blood pressure, all this kind of raises the amount of fluid perhaps in your volume of your heart. And if you have underlying conditions, that's certainly something that would push you over the edge. Okay,
alcohol, we know that affects the liver, obviously, but how does it affect the heart?
Well, the heart, first of all, there's a syndrome called the Holliday heart syndrome, and it's well-founded. This is something where people who drink excessive amounts can go into irregular heart rhythms, atrial fibrillation, supraventricular tachycardia. The heart's going too fast, it's irregular. And again, if you have an underlying condition to begin with, that will help you decompensate. And then even young, healthy people, if you binge drink, you know, all of a sudden your favorite friend's in and you guys are just putting down 40 ounces or, you know, taking shots. Well, the heart doesn't like that. And it can even affect the heart muscle, making it weak and causing you to go into congestive heart failure, even if you're healthy, but especially if you have underlying heart conditions. So drink alcohol in moderation. You know, a drink a day for women, 2 drinks a day for men. You know, we may push that a little bit, obviously, for the holidays, but realize that alcohol is not your friend and certainly could send you to the hospital.
All right, I only have time for one more.
Absolutely.
Ignoring symptoms or catching a bug. What do you want to focus on?
Let's talk about ignoring symptoms.
Okay, because those are important. You want to know the signs. Okay.
Absolutely. Not so much knowing the signs. We know the signs. You know, heaviness, fullness, tightness, squeezing, aching, shortness of breath. In women and diabetics, you know, you may feel more fatigued. Okay. But the main thing is, I don't want to go to the emergency room. It's Christmas Eve. You know, I don't want to go. I have a house full of company. You know, it's Christmas. I don't want to be in the hospital. Please don't ignore. Time is important. Time is muscle. In the case of stroke, again, the earlier you get to the hospital, we can perhaps prevent that stroke. So again, don't ignore symptoms. Have a happy holiday. Don't let Grinch steal your Christmas.
Merry Christmas to you, Dr. Fletcher. Thanks so much for coming in, keeping us healthy. You can always be healthy with Baptist Health by calling the number on the screen or going to the website baptist-health.com.